Welcome, welcome, welcome. Peace and blessings. I am Belinda Gordon Battle, host for Mental Wellness for the Culture. We have an opportunity to bring professionals, experts, people in our community that look like us, that sound like us, that have representation within our community, and want to make sure we know how to access and utilize mental health professionals. Mental Wellness for the Culture is so excited to be in their fifth season and to have Dr. Alicia Rodriguez here with us. She has a message from the world of sex therapy that we have not touched upon, but is definitely needed. And I am excited to have her voice as part of our family and our platform. Welcome, Dr. Rodriguez.
Thank you. Hello, hello. Well, yes, as you mentioned, I'm going to speak today a little bit about sex therapy. I am a psychotherapist, clinical sexologist, licensed here in Florida, as well as several other states, including Virginia, Colorado, and Utah. And when you hear that word, sex therapist, clinical sexologist, what is that?
That's what I was thinking. That's exactly what I was thinking. I love that. Go right into it.
Yeah,
Thank
and
you.
a clinical sexologist or a sex therapist, basically a mental health professional, and we're trained to address concerns that are related to sexuality, intimacy, and sexual functioning. And we work with individuals and couples that are navigating issues such as desire, discrepancy, trauma recovery, gender identity, and even sexual dysfunction. And our role in itself is rooted in evidence-based practices where we're affirming education and a non-judgmental client-centered approach.
Yeah, I love that. I'm in my mind. I'm thinking, but why? Like, why, Dr. Rodriguez? Why do we even need to know about sex therapy? Why did you decide this was an option for you, as far as your career?
Well, definitely, I wanted to see, more people that, look like me. We don't have a lot of that. And I'm like, I need to put myself out there and get the education that I need so that I can be able to educate the community, educate individuals, couples, and even families, and children too. A lot of times when you think about sex therapy, you don't put children and sex together because we want to
Yes.
kind of hide our children away from that topic,
Mhm.
right? And there's three different pillars. There's sex therapy for adults, comprehensive sex education for teens, and also risk reduction and offense prevention. Because a lot of times when we shy away from that topic, if you're not being educated in the schools, educated at home, our children get curious, and adults get curious when they're feeling shame for some of these things, and usually turns into offenses, unfortunately.
Can you explain that a little bit more? Offenses related to sex.
Right. So what happens is we have to address prevention from a public health lens. And
Okay.
this includes identifying early cognitive distortions that can lead to harmful behaviors that provide early interventions. And we work with at-risk individuals using relapse prevention plans and accountability networks. And also promoting age-appropriate sexuality education to create a foundation for healthy development before problems arise, because
Absolutely.
we have children that we're seeing more and more and younger. They have this unlimited, unfiltered access to social media, to the internet, and they're looking these things up because, formal sex education sometimes is not being taught in schools anymore.
Yeah.
And parents aren't talking about it because they feel like, well, if I introduce this topic to him or her, they're going to want to start doing this. We're like,
Right.
no,
Yeah.
they're already thinking about it. They're talking to their friends about it. So it's the
Absolutely.
blind leading the blind. So they're doing all this looking on social media and the internet, and they're learning the wrong way. So they get
Yes.
curious and want to investigate it.
Absolutely. And it's best to have them make sure that they understand a healthy way to deal with sex. But when
Absolutely.
you talk about early cognitive distortions, help my audience understand what's a real anecdote. What's a anecdotal story? Somebody that you've seen over the years, someone that you know has kind of presented these
Mm,
distortions. What does that look like in real time?
so an example would be, let's see, I had an 11-year-old
Mhm.
court mandated. So ordered to come to therapy because they got charged with having inappropriate content and exhibiting inappropriate behavior. So an early cognitive distortion where you would have, well, let me just first go out to the antidote, because
Okay.
it's often found through a combination of awareness, re-education, and corrective emotional experiences. Specifically, the most of those approaches are inner child work, corrective emotional experiences, psychoeducation, mindfulness. So an example would be, let's say an 11-year-old that's introduced to pornography through a friend. You're
Yes.
looking at this video on the phone, and I was okay, like, what is this thing? So now they're getting curious and they're starting to look at these things.
Right.
And as you're still developing, our frontal lobe is not fully developed until we're 25.
Mm-hmm.
And so you're looking at these images and these videos and you're seeing what isn't reality, the actors, the actresses, and the different things that they're doing in there. So now you're starting to explore yourself, and you think this is the way that I should be performing, or this is what I should expect from my partner to do to perform.
Right.
And then you're getting curious as a child, taking pictures or videos of yourself and sending them to friends, or friends sending them to you. And now what a lot of our kids don't understand is, now you're in possession of child pornography.
Exactly.
Now once you sent it, you are distributing child pornography. And they don't really fully understand that. And they're like, well, I'm a kid too. Well, yeah, but the image that you shared was of a kid also. Like, they don't fully understand that.
Right. And I think we have to do more in our community to teach that concept and to make sure we make that connection between it. If you are sending the picture of someone else, then you are distributing child pornography. We are not doing as much as we can to make sure that children understand that, but also that adults understand that.
Yeah, and teen education is prevention and action. We're empowering young people with accurate information about anatomy, boundaries, consent, and communication. And through interactive models, like when we talk about myths about sex versus facts about sex, digital safety education, role plays, we are equipping our teens to make informed choices and navigate sexuality with confidence and care.
Right. Sex and sexuality and gender issues, they are such a large part of our life. But they're so, it's quiet. It's quiet out there about these things. And I think I'm so glad you're here, because I want to make sure that when we talk about mental wellness, that we include all aspects of the being, of the person. And I think this is so important. What made you decide, I'm going to make sure that I'm going to be a part of this community that teaches about sex therapy? Because as we said on the pre-show, we were just chatting, I said to you, I do not know another person that's doing the work that you are doing in our area. And I know you're in Colorado, you're in Virginia, you're in Florida. Where else? I'm missing something.
Utah, but I'm licensed in all those states, but I'm based here in Florida.
Yes. And so for me, I'm like, you're spread out across the country, but you're here for us here right here in Florida. But what made you say, this is important, I'm going to do this, I'm going to stick to it? And how are you being received in the community for the work that you're doing?
Well, it's been an overwhelming amount of acceptance, which is great, because, there's such a need for this. And, also trying to uplift other therapists that are coming up and getting them more involved and wanting to do this, because we do have, mental health therapists, social workers. And a lot of times what I've noticed, prior to getting, my clinical sexology degree and becoming a certified sex therapist, I, just being a licensed marriage and family therapist and a mental health counselor. So I didn't have that additional training in sex therapy. And what made me want to do that is I realized that there were a lot of mental health therapists and marriage and family therapists that I was running into, where I kept hearing the same stories. You get a client that will come into your office, whether it's an individual having an issue about a sexual dysfunction or sexual repression, Whether it's erectile dysfunction, female orgasmic disorder,
Mm-hmm.
or you'd have a couple coming in, you have a high desire partner and you have a low desire partner. So you're coming in and you're talking to your therapist that you've
Mm-hmm.
probably been seeing for months to years, and you're talking
Yes.
to this therapist about the trauma in your childhood, the issues that you're having at work, the stress, anxiety, depression, and you're talking to them about all these things. You're being vulnerable. But then the minute you bring up that topic of sex,
Exactly.
the therapist kind of is like, okay, let me refer you out.
Right.
Let me refer you out to someone else because they're not. And this goes back to our training in school, in grad school. They don't really touch on sex
They
therapy.
don't.
They don't talk about this in grad school. So you
No.
have these therapists referring the clients out to the, because obviously if it's not in your wheelhouse, you definitely want to refer the client out because you're going to do more harm than good if you're not
Yeah.
fully equipped. But I think it's important for therapists to at least be trained and have some type of training to
Mm-hmm.
assist rather than pushing that client off immediately. Because think of it from a client's point of view. I'm
Exactly.
telling you all these things about me. And the moment I talk about sex, you're like, wait, wait, wait.
Yes.
Yeah, I need you to go somewhere else. So you're like, well,
Absolutely.
dang, like how messed up am I if I can't talk to my therapist about
But
this?
but doesn't that just replicate a lot of what goes on in our homes?
Yes. Yes.
The
Yes.
same
And
idea. As
exactly.
soon as a child or someone in the family says something about sex, please be quiet. Don't speak on that. Or go to someone
Mhm.
else and they'll tell you. Don't
You are
don't put me on the
exactly
spot to
right.
talk to you about that.
Yes,
Yeah.
yes.
Yeah.
The stop lights go on, it's like, no, no, I don't, let's not talk about this,
No.
and when we talk about, sex therapy for adults, we often see clients that are facing loss of desire, performance anxiety,
Mhm.
or struggling with intimacy after trauma. And there are different tools that we use, like sensate focus, cognitive behavioral techniques, and mindfulness, where we help clients reconnect and build pleasure, with pleasure and build intimacy in safe, consensual ways. And when we talk about, sex therapy for adults, our comprehensive sex education for teens, and then
Mhm.
going into risk reduction and prevention, sexual wellness exists on a continuum.
Yes.
By addressing adult healing, empowering youth, and interrupting cycles of harm, we're
Mhm.
creating these communities that are grounded in safety, trust, and emotional intelligence.
Yes.
And this framework doesn't just treat symptoms, it builds a stronger foundation for healthy identity, connection, and
Yeah.
accountability across the lifespan.
Absolutely. When you speak about community, I think about the community that we have created here on the culture, and just having that opportunity to speak to women and men that are part of the culture family. I was thinking
Mhm.
that recently there was a conversation about menopause,
Mm.
perimenopause, and sexuality, and just feeling that level of intimacy. What can you say to women that are, I guess, between the ages of 40 and 60 that may be
Mhm.
in that space, and also their partners?
Mm.
Mm-hmm.
So perimenopause and menopause, it marks a significant hormonal and life transitions that it can deeply impact, a woman's sexual health and affecting the partner as well, and this phase, it often involves that fluctuation of your estrogen levels,
Mm-hmm.
decreasing libido, vaginal dryness, pain during intercourse,
Right.
and shifts in your body image, and all of these things can affect sexual desire
Mm-hmm.
and arousal and relational intimacy. Um, a lot of common sexual health concerns are usually low libido, and that's where
Mm-hmm.
decrease in your spontaneous desire for sexual interest
Mm-hmm.
because of those hormonal changes. Vaginal dryness, like I mentioned, the declining of estrogen levels, your body shifts, whether it's weight gain, changes in your skin elasticity,
Right.
emotional and relational factors, empty nest transitions, your kids leaving the home, role shifts, or
Mm-hmm.
partner changes might also influence intimacy. And from a therapeutic aspect, the different approaches that we have are, psychoeducation, normalizing the biological and emotional changes during this transition, mindfulness and sensate focus. That's where helping clients re-engage with sensuality and
Yeah.
pleasure, encouraging non-goal oriented touch to
Mm.
reframe sexual intimacy beyond performance. Because a lot of times we have this.
Non-goal oriented touch.
Yes,
Okay, you got
because
to
we
give us a
have
little
been.
bit more about that
So
non-goal oriented touch.
So society has given us this perception that, the goal of sex is to have an orgasm. Well,
Mhm.
no, what if I don't want to have an orgasm? What if I just want to enjoy the touch of my partner? What if my sexual gratification is seeing my partner aroused or watching my partner have an orgasm? And
Yeah.
with that non-goal oriented touch,
Mhm.
when you're touching your partner, when you're pleasing your partner, you're not looking for a goal at the end. You're not looking for, okay, the reason I'm touching you, the reason why I'm kissing you, the reason why I'm saying I'm having this foreplay is because there's a goal at the end. It's because I want you to have an orgasm or whatever that goal is.
Yes,
So
yeah.
taking that off the table, because then
Mhm.
just like athletes, having sex, you have performance anxiety,
Right.
just like an athlete would before a game. So
Yeah.
you're prepping up for this, and then when that climax doesn't come, then you're let down. But if there's no goal, if
Um,
I'm just touching you to please you, then we're
yeah.
both enjoying this moment.
And think how freeing that may be for a lot of people to know that they do not have to have that climax. The outcome
Hmm.
does not have to be an orgasm. Like we
Yes.
really can just touch each other freely and not have that pressure for an outcome.
Absolutely. And Sensei Focus, I realize has helped so many of my clients. When you take that off the table, when you take sex off the table, we're just talking about physical touch. What feels good to you? Let's try these different Sensei focus activities by touching different parts of the body
Mhm.
that don't include your sexual organs. Hey, I didn't know that I like it when you touched me on the back of my knee. Oh, I didn't know I like it when you touch me on my collarbone, because you
Mhm.
haven't explored these things. You've been so focused on, the act of sexual intercourse. You
Mhm.
haven't thought about the touch, the non-goal oriented physical parts of it. And with the couples work, just supporting these honest conversation around
Mhm.
changing needs,
Mhm.
expectations, and
Mhm.
intimacy style. Um, Menopause isn't the end of sexuality. It's a
Right.
recalibration,
Mhm.
with the right,
Recalibration. I love that.
yes, it's a
Yes.
recalibration. With the right support, the
Mhm.
stage can be liberating
Mhm.
and a pleasurable chapter,
Mhm.
marked by self-discovery, emotional wisdom, and, redefined intimacy.
Yes. Well, Dr. Rodriguez, I have so many thoughts right now. I feel like we're going to have an entire different opportunity and platform to talk to women and their partners about menopause and perimenopause and just sex in general during that time.
Hmm.
Um, it's it's so exciting to me to know that we have an expert in our community that we can reach out to and talk to about these things that are going on. What have you seen to be the usual way of introducing a therapist into a couple's relationship? Is it an easy access type of situation? Is it difficult to bring for you to enter that relationship with a couple?
It's been easier than expected, because a lot of times you might have just one partner coming. Oh, because my husband or my wife or my partner, they're just over and they're kind of, I've been voluntold to come to therapy.
Okay.
I've been
Okay.
voluntold to come.
Yes.
And I want to save my relationship, and
Mhm.
that's how it usually starts, as an individual one-on-one. And during from the very first session, something that I propose is, would you, I know that we're starting out as like in your individual, but would you feel comfortable at some point if we introduce your partner into the session and have some
Mhm.
couples therapy? And they
Mhm.
tend to feel better and more at ease when we do it that way. They feel like the pressure's off. Like my partner's already kind of making me come, where I'm coming because I
Right.
want to save my relationship, not because
Yeah.
my partner's making me come. But hey, you're giving me that open window to say I could bring them in here,
I
and
love
and and,
that.
and it never fails. They end up bringing their partner in after the third or fourth session, and hearing their partner, hearing them say things that they usually wouldn't feel comfortable saying to them one on one, but
Right.
having that non-judgmental space
Mhm.
and having
Mhm.
that room to speak freely, it's easier for them to get those words out.
That's awesome because I think what I hear you saying is that you make sure you create a safe space, and it may start off with the individual, but you have that opportunity to bring in the partner, the husband, the wife, and to make sure that everybody can get something out of the process of healing.
Absolutely.
That's so important. I hear you talking from a medical model. I hear you talking from a wellness model. It seems like those two must have to come together for sex therapy.
Oh yes, absolutely. Because we have, like, when we're doing our biopsychosocial, getting the complete history of the client. Sometimes it might be something that's cognitive, because we're our own worst enemies. We get stuck in our heads sometimes, a lot
Yeah.
of times. And so, as from a medical model, you have to kind of go into, okay, when did this problem start? When did you start feeling this way? And we rule out certain things. Like, it might be something medical. Like,
Mhm.
when's the last time that you saw your physician? When's the last time that you had checked for certain things? So it kind of works hand in hand.
I remember some years ago, I was working with a couple, and the husband had not informed his wife that the doctor placed him on blood pressure medication. And at that time, I don't know how, I haven't followed up over the years as far as medication is concerned. But at that time, the blood pressure medication decreases his ability to have an erection.
Mhm.
And the wife was unaware that he was taking the medication. So she came to therapy very much distraught that the relationship had completely changed. What are your thoughts on that about communicating and making sure that everyone that's involved knows exactly what's going on?
That is why that communication in any relationship is key. Because again, had she known this, she might have known that something new was introduced to his body that possibly, caused an interruption in their sexual intimacy.
Yeah.
It's key in sexual health and in our relationships because it creates the foundation of trust, safety, understanding, and intimacy. What you mentioned is so important with the blood pressure medication, and not only that, but many other medications,
Mhm.
because it can significantly affect sex,
Yeah.
both positively and negatively.
Right.
Depending on the type of medication, the dosage, and the person's individual biology. Antidepressants, especially SSRIs and
Mhm.
SNRIs, commonly cause like libido, lower libido, delayed orgasm.
Mhm.
Some people also experience erectile dysfunction or vaginal dryness.
Yes.
Blood pressure medication, like you mentioned, those are our beta blockers, and our diuretics that can cause erectile issues and decrease arousal because you're reducing the blood flow. So
Yeah.
absolutely, that communication has to
So
happen.
important. And I have to let you know that once she realized that, she was very supportive and understanding, but it did take some time for him to share that he was on this medication and this was affecting him. How do we make sure our partners are available and willing and open to have these conversations?
Mm. Um, some of that, and everyone has their own thing going on
Mhm.
as to why, but some of it, might be shame as to why they don't share.
Yes.
There's cultural conditioning,
Yes.
and masculinity norms.
Yes.
Many men are socialized to associate vulnerability with weakness.
Mhm.
They're taught to man up,
Right.
push through or suppress these
Make it
emotions,
happen.
make it happen.
Right.
Fear of judgment or rejection, even lack of emotional vocabulary. If
Mhm.
emotional
Mhm.
openness wasn't modeled growing up,
Yeah.
men might struggle to identify or articulate what they're feeling, let alone share it.
Yeah.
Even previous negative experience. So the way that we create a space where sharing feels safe,
Mhm.
lead with curiosity, not criticism. So
Mm.
you can
Lead
ask,
with curiosity and not
not
criticism. Okay.
criticism. You can ask open-ended questions like, how have you been feeling lately? Or, is there anything you need more of from me,
Mhm.
without pressure or blame?
Mhm.
Affirm vulnerability. When our partner does open up, acknowledge it. Thank you for sharing that. It means a lot. Or that must have taken courage to say. Um, Avoid fixing, focus on
Mhm.
learning.
Mhm.
I'm going to
Mhm.
say that again because
Mhm.
a lot of us, especially as women, we're
Please say it.
fixers, right?
Yes. Please say it again.
Avoid fixing,
Not
focus on
fixing.
listening.
Focus on listening.
Many men are used to problem solving mode. When
Mhm.
they speak vulnerability, they often don't want advice,
Right.
just presence and understanding. So
Yes.
just listening would be a very important, and model openness yourself. You know,
Mhm.
being emotionally transparent can encourage reciprocity.
Yes.
Share your own feelings in a way that's grounded and non-threatening, and be patient.
Yeah. Be patient and share your own feelings. I love this audience. You better be taking notes because these are things to live by. I appreciate what you are sharing with our audience, Dr. Rodriguez. I do want to make sure we touch upon our teens. And I know you talked
Mhm,
about the social media aspects and how they can become just kind of engaged in that social media world and not
mhm,
as engaged in real life relationships.
mhm.
How can we make sure that we are guiding our teens the best way possible and giving them the information they need to have healthy sexual relationships?
Definitely encouraging, I definitely want to encourage parents to be open to listening to them.
Yeah.
And as teens, they give you that pushback. They don't want to talk to
Mhm.
you. They want to go with their friends and do their own thing.
Mhm.
But let them show that you're going to continue to show up, and you're going to
Right.
continue to ask, because again, it's going to be the blind leading the blind, and they're
Mhm.
going to learn these things in all the wrong ways. There's so many resources out here. Like I myself, I teach a healthy digital practices class, a group every Thursday to teens, where they learn about proper social media usage, how to, you know, decrease your digital footprint, how to be a digital citizen.
Yeah.
So all these different things. So definitely be present and
And you
ask the
teach
questions. Don't
the,
be
I'm
afraid.
sorry, you teach the class to the teens, not the parents,
Yes,
to the
to
teens.
the teens. There's a workshop I'm coming up with right now that someone literally just asked me yesterday about. I'm preparing to start offering a virtual workshop to parents. That will definitely be a big help to them, because I
Oh
know
my
we focus
goodness.
a lot on the teens and we forget, hey, you know, the parents need to learn this too.
Yeah.
You know,
So you're going to share that information with us so we can make sure our community can become involved.
I absolutely will.
Okay,
I
okay.
absolutely will.
I love it. I love it. I'm so glad you are here to offer that because it's so needed, and your expertise is going to go a long way in helping our community to be as healthy as
Mhm.
possible. This is something I want to talk about. There's so many things I want to talk about when it comes to sex therapy. I just feel like you just hit the top of the iceberg, the very tip of the iceberg.
Mhm.
What's one thing that you really want to make sure our community explores, they know about, that they are making some effort to learn more about?
Oh my goodness, just one?
One. Okay, two. Okay, two.
Um, Sexual health is mental health. You know, our emotional, relation, and psychological well-being are deeply connected to our sexual identity and functioning. So
Absolutely.
when you think about mental health, think sexual health. When you think about sexual health, think about mental health.
Hmm.
And when it comes to, you know, our teens, empowered education prevents harm. Teaching our teens accurate, age appropriate sexual information builds confidence, it reduces risk, and supports lifelong sexual wellness.
Absolutely. Those two things are so very important. And the conversation has to grow. We have to continue to talk about sex therapy, intimacy, being a teenager, and different age ranges, because we could talk about sex from the time someone is an infant and born into the world and intimacy all the way until they are in their last stages of life, because it's a part of
Yes.
that process and development and growing. I want to thank you so much, Dr. Rodriguez, because you have allowed us to begin this conversation on this platform where mental health and sexual health are integrated in one. And we want to make sure
Thank
we
you.
continue the conversation. So I will be inviting you back. This is a place you can always call me and say, I have something I want to say. And this platform will be available to you. As we close, I want to just give you a chance to answer some questions, just quick fire questions about yourself.
Sure.
You ready?
I'm
What's your
ready.
favorite ice cream?
Rum raisin.
Rum raisin.
Yes,
I
that's the
only know
Jamaican
one
in
other
me.
person in the world that likes rum raisin ice cream.
Now you know too.
Oh my gosh, that's amazing. Amazing. What about your favorite natural juice?
Ooh, carrot juice.
Oh, carrot juice. Okay, that's a good one. Just by itself. Don't split it with
Yes,
anything.
carrot juice, or well, it's a top two: carrot juice and pineapple juice. But
I
yeah,
love
carrot
pineapple.
juice.
Yeah, I love that. I love that. Share with our audience your favorite vacation, the one place you went where you want everybody to go.
Ooh, Greece.
How was that? Talk to
It
me.
was amazing. Santorini, Greece. You will not regret it. You
Oh,
will
I
not.
love that. You closed your eyes when you said it. So you had that visual. You had that visual. That's perfect. Greece. We all have to go to Greece one day.
Yes.
Yes. So thank you for being here. So you have your classes coming up, virtual
Yes.
groups with teens. On what night is that
Mhm.
again?
Thursday nights, virtual group with teens, working on doing a workshop for adults, so get some adult education in there, so you can speak to your teens, give them that proper education.
How can our audience get in touch with you if they want to have a individual session, a couples counseling, group therapy?
Sure.
How do they get in touch with you?
So my website is myuniquetherapy.com. My practice is called Unique Therapy, fully virtual telehealth, mostly Monday through Friday, some weekends. And we accept mostly all insurances and EAPs as well if you're going through your employer. And it's confidential, so your employer doesn't know like what you're talking about in therapy.
EAP, employee assistance programs. You tap
Yes, my
into
apologies.
those and you could be, yes, you could receive services through EAP and you are already paying for that because
Yeah.
it's part of your insurance.
Hmm.
I love that. I love that. And what about your availability to speaking engagements, presentations, panel discussions?
Oh, I'm always gonna make some room in my schedule. This is something I'm passionate about because I think education is important. Being able to educate our general audience as well as our parents and our other clinicians that want to learn about this. So I'm available for speaking engagements. You can find my email on the website, but my direct email is Dr. Alicia Rodriguez at myuniquetherapy.com. So that's Dr. my first and last name
Mhm.
at myuniquetherapy.com.
Well, thank you so much for coming on and just introducing this topic of sex therapy to us. Is something we need to know more about, and we will continue to learn individually and as a community. I can't get it out of my mind that you said sexual health is mental health, and mental health is sexual health. Thank you for
Yes.
sharing that with us today, and we look forward to continuing the conversation soon.
Thank you for having me.